Dr. Saunders here to tell you a little bit about my story, why I do what I do in health and wellness medicine. I went to medical school probably for the same reason almost all doctors go to medical school, and that is to help other people. I wanted to be able to cure disease, to help them, to really make people feel better, to have good health. I went to UCLA Medical School and worked really hard to learn all of this. And then when I was in residency is when you really start to get to know people, to see patients over a period of time. One woman who came in to see me had chest pain. And of course, whenever anybody has chest pain, we worry about a heart problem. So I sent her to a cardiologist. Within a week or so, I got the report back with a clean bill of health. Everything was fine. EKG was done, echocardiogram was done, treadmill, she was fine. And he said, no problem with the heart. That's not the reason for her chest pain. Well, 2 weeks to the day after she got that clean bill of health, I was working in the emergency department and she came in having a heart attack. And she went to the operating room, they did bypass surgery, but she didn't make it. That caused me to reflect a lot. What is it we're doing if we don't even know what people have, or we can't cure illnesses? Many other things subsequent to that. I found people with arthritis that all I could do is give them a pill to help them feel better, and even that didn't work well. It was sort of putting a Band-Aid on something that was a much bigger problem. And I found many of those kinds of things as I was trying to help people get well. So I started looking into other options. What alternatives are there? Someone would come to me with a problem like diabetes. Let me give you an example. One man came, he had been to his doctor and he told his doctor, I don't feel good on this medicine, doctor. I need to get off it somehow, or isn't there something else we can do? The doctor said, nope, that's all there is. You're going to be on it for life because that's all there is, and that's the only way you can control your blood sugar. So he came to see me looking for an alternative. Well, I started reading about diabetes and looking into it and found that there's plenty of ways to help him get off his medication. There's plenty of other options. There's herbal options, there's nutritional options, exercise helps a lot, and significant lifestyle changes. When I found that out, I was very enthusiastic about it, and I said, look, there are other options. You can get off your medications. Well, this was a happy ending, this story, because he did get off his medications, he did control his blood sugar, and to this day he's feeling great and living well, and he has energy, and he's very happy about what he's done. With many other stories like that, I decided that I would do wellness medicine instead. So instead of putting people on medications, I work to get people off medications. And the reason for that is because people who are on chronic medications most of the time are not well controlled, or they don't feel well on them, or are having side effects from them. So in order to get rid of the side effects and get rid of the problems, then I find ways to help them control the illness or even get rid of the illness without having to take medications. Because of that, I started a wellness center. And the wellness center, people come in with all kinds of illnesses, and we work on lifestyle changes. We use any therapy that's necessary. Yes, I even have some people who are still taking prescription drugs because they just need to. Some people just need to for a period of time. However, we've been very successful in getting people off their medications, in helping them get well, and feeling good and feeling well and having the best life they can possibly have. That's why I do what I do now, and that's why I love what I do now.